there is a better understanding across services about the experiences of Black children in terms of both representation, disproportionality. However, it's also dependent upon each individual agency's commitment to anti-racist practice and being committed to that. We have to acknowledge the structural conditions which exist within our society and understand how structural harm informs the ways in which we view and identify particular groups of children, who we view as more deserving or less deserving, who we view as somehow more capable or more competent or more resilient, and those who we then view as in need of our protection. So that for me goes hand in hand as well to why there may be a lack of understanding, why there might be a delayed response, the ways in which referral forms are completed and what referral pathways look like. So I think there are a number of things I'm naming because I don't think it is just one easy response. I think there are multiple contexts and factors which impact. And do I think that practitioners as well as senior leaders are moving in the right direction? I would say yes. I think there has been lots of work to really amplify, challenge and hold the system to account. But I wouldn't ever want to get too comfortable. A lot of the times we say, let's get comfortable with the uncomfortable. Let's not get complacent though. Let's not think that there isn't more to do. We know based on what evidence tells us, we have much more to do and we need to remain and be consistent with that. If a child is experiencing harm, whether it could be in the home, they're experiencing harm in their school, they're experiencing harm, in terms of when they go, if they've got a referral to CAMHS and there is a lack of understanding or trauma isn't presenting in the way or the idea in which trauma is supposed to present, depending what our image of trauma looks like. If a child is neurodiverse, but their focus is around what behaviour they're presenting with, but no questioning around what that behaviour might be an indicator of. When you're a Black child, those things are compounded and intertwined with racialized and very problematic stereotypes. So for me, when we're talking about how or if and to what extent, it's embedded in our systems. So what's really crucial for extrafamilial harm, what's really crucial for this guidance is an acknowledgement that no matter the framework we apply and use, we have to acknowledge the systems which are already and those structural harms which are embedded in our system. So our frameworks, if not, managed or acknowledged or supported through a lens of that kind of cultural humility, sensitive approach, what we can end up doing is repeating those same harms, even with good intention. And that's why I think when we have conversations about conscious or unconscious, it's not about that. It's about acknowledging the structural conditions in which these harms are allowed to continue, and we need to be able to acknowledge that as a system and as individual practitioners as well.